Enteric fever is a serious illness caused by specific types of bacteria. You might have heard of it by its other name, typhoid fever. This infection is caused by a germ called Salmonella typhi. Another milder form called paratyphoid fever is caused by Salmonella paratyphi. These bacteria typically spread through contaminated food and water. When someone consumes something that has these germs, the bacteria can enter the body and start to multiply. This leads to the sickness we call enteric fever. It is a significant health concern in many parts of the world, especially in places where sanitation and access to clean water are challenges. Understanding what it is represents the first critical step in protecting yourself and your family from this preventable disease. The signs of enteric fever often develop slowly, usually 1 to 3 weeks after a person has been exposed to the bacteria. One of the most common signs is a high fever that gradually increases over several days. This isn't just a small temperature. It can climb quite high, often reaching 103 to 104 degrees Fahrenheit, or 39 to 40 degrees Celsius. Along with the fever, people frequently experience a persistent headache that just won't seem to go away. They may also feel very weak and tired, a general feeling of being unwell known as malaise. These initial symptoms can sometimes be mistaken for other common illnesses, which is why paying close attention to how they progress is so important for everyone. As the illness continues, other symptoms can start to appear, giving more clues about what is happening inside the body. Many people with enteric fever report having stomach pains and a general feeling of discomfort in their abdomen. You might also notice changes in your digestive system. Some people experience constipation, where they find it difficult to have a bowel movement, while others might have the opposite problem, which is diarrhea. Another distinctive sign that can sometimes appear is a rash. This rash consists of small rose-colored spots usually found on the chest and abdomen. It's a key signal for doctors, though it doesn't show up in every single case of the illness. Beyond the physical symptoms, enteric fever can take a toll on a person's overall state of being. The constant high fever and body aches can be exhausting, leaving individuals with very little energy for daily activities. A loss of appetite is also extremely common, which can lead to weight loss if the illness persists for a long time. In some cases, people might feel confused or have difficulty concentrating, a sign that the infection is having a more widespread effect on the body. It is the combination of these symptoms, the high, sustained fever, the body aches, the stomach issues, and the profound fatigue, that paints a clear picture of enteric fever for healthcare professionals trying to make an accurate diagnosis. When a doctor suspects you might have enteric fever, they won't rely on symptoms alone to make a final decision. The first step is a thorough physical examination and a detailed conversation about your symptoms and recent travel history. They will want to know where you have been, what you have eaten, and if you might have been exposed to unsafe water sources. This information is crucial because it helps them build a case for or against enteric fever. The doctor will check your temperature, look for the characteristic rash, and gently press on your abdomen to check for any tenderness or swelling. This initial assessment helps them decide which tests are needed to confirm the diagnosis. To be certain about enteric fever, doctors need to find the specific bacteria in your body. The most reliable way to do this is through a blood culture. For this test, a small sample of your blood is taken and sent to a laboratory. In the lab, the blood is placed in a special dish that helps bacteria grow. If Salmonella typhi or Salmonella paratyphi are present in your blood, they will multiply over a few days, and technicians can then identify them under a microscope. This test is considered the gold standard for diagnosis because it provides direct proof of the infection. It is most effective during the first week or two of the illness when the bacteria are actively circulating in the bloodstream. In addition to a blood culture, your doctor might also request other samples to look for the bacteria. A stool culture, where a small sample of your feces is tested, can also be very useful in detecting the germs. Sometimes a urine sample is also collected and analyzed for the same purpose. These tests can be particularly helpful later in the course of the illness, as the bacteria may no longer be as plentiful in the blood, but can still be found in the digestive tract. In some specific situations, especially if the diagnosis is still unclear, a doctor might perform a bone marrow culture. This is a more invasive procedure, but is highly sensitive for detecting the bacteria. Another type of test that doctors sometimes use is a serological test, which looks for antibodies in your blood. Your body produces these antibodies to fight off the infection. A common example is the Widal test. However, these tests are often less reliable than cultures. They can sometimes give a positive result if you have had a similar infection in the past, or they might be negative in the early stages of the current illness. Because of this, doctors usually rely on culture results to make a definitive diagnosis. Combining the patient's symptoms, travel history, and the results from these laboratory investigations allows doctors to confidently identify enteric fever and start the correct treatment promptly. The primary treatment for enteric fever is a course of antibiotics. These powerful medicines are designed to kill the bacteria that are causing the infection in your body. Once the diagnosis is confirmed, your doctor will prescribe an appropriate antibiotic. The specific type of antibiotic used can depend on where you live and which strains of the bacteria are common in your area, as some have become resistant to certain drugs over time. Common choices include ciprofloxacin, azithromycin, or ceftriaxone. It is incredibly important to take the full course of antibiotics exactly as your doctor prescribes, even if you start to feel better after a few days. Stopping the treatment early could allow the bacteria to survive and cause a relapse. Alongside antibiotics, supportive care is essential for a smooth recovery. A high fever can cause dehydration, so drinking plenty of fluids is a top priority. Water, clear broths, and oral rehydration solutions are excellent choices to help replenish the fluids and electrolytes your body has lost. Getting enough rest is also crucial. Your body needs a lot of energy to fight off the infection, so you should avoid strenuous activities and allow yourself plenty of time to sleep and recover. A healthy, easily digestible diet can also help. Your doctor might recommend soft, bland foods that are gentle on your stomach until your appetite and digestive system return to normal. Most people with enteric fever can be treated effectively at home with oral antibiotics and proper supportive care. However, if the illness is severe or if complications develop, hospitalization may be necessary. In the hospital, you can receive antibiotics directly into your bloodstream through an intravenous line. This method delivers the medicine more quickly and can be more effective for serious infections. You can also receive intravenous fluids to combat dehydration if you are unable to drink enough on your own. Healthcare professionals will closely monitor your condition, including your temperature, blood pressure, and other vital signs, to ensure the treatment is working as it should. Following your doctor's instructions carefully is the key to a full recovery. This means completing your antibiotic prescription, staying hydrated, getting adequate rest, and eating nutritious food. It is also important to practice good hygiene to prevent spreading the infection to others. This includes washing your hands thoroughly with soap and water, especially after using the bathroom and before handling food. You should also avoid preparing food for other people until your doctor confirms that you are no longer contagious. Following these simple yet critical steps will help you get back on your feet and protect the health of those around you. While most people recover from enteric fever without any issues, there can be serious complications if the illness is not treated quickly or effectively. One of the most dangerous complications is intestinal bleeding or perforation. A perforation is a hole that develops in the wall of the small intestine or large bowel. This is a medical emergency because it can allow the contents of the intestine to leak into the abdominal cavity, leading to a life-threatening infection called peritonitis. Signs of this complication include sudden, severe abdominal pain, a drop in blood pressure, and a rapid heart rate. It is a stark reminder of why prompt medical attention for enteric fever is so vital. Managing these severe complications requires immediate and intensive medical care, almost always in a hospital setting. If intestinal bleeding occurs, a patient might need blood transfusions to replace the lost blood. For an intestinal perforation, emergency surgery is typically required to repair the hole in the intestinal wall. During the surgery, the surgeon will also thoroughly clean the abdominal cavity to remove any leaked contents and prevent widespread infection. The patient will receive powerful intravenous antibiotics to fight the peritonitis and will be monitored very closely in an intensive care unit during their recovery from this major operation. Other, less common complications can also arise from a severe enteric fever infection. The bacteria can sometimes spread to other parts of the body, leading to problems like pneumonia, which is an infection of the lungs, or meningitis, which is inflammation of the membranes surrounding the brain and spinal cord. In rare cases, the heart muscles can become inflamed, a condition known as myocarditis. Each of these complications requires specific treatment. For example, pneumonia would be treated with targeted antibiotics, while meningitis would necessitate high-dose intravenous antibiotics and careful monitoring of brain function. These issues highlight how a localized infection can become a systemic problem. In conclusion, enteric fever is a serious bacterial illness that begins with symptoms like a high, sustained fever, headache, and stomach pain. A definitive diagnosis relies on laboratory tests, such as blood cultures, to identify the bacteria. Treatment is centered on a course of antibiotics and supportive care, including rest and hydration. While complications like intestinal perforation are rare, they are severe and require emergency medical intervention. The best way to manage enteric fever is through early diagnosis and proper treatment, which greatly reduces the risk of these dangerous outcomes. By understanding the illness, we can take the necessary steps to treat it effectively and ensure a safe recovery.